Thank you for tuning in to watch Anti-Racism and Ethnic Diversity in Creative Health, addressing inequality within the social movement. This event is brought to you by our Midlands Creative Health Associate, Jane Hearst, in partnership with Tamina Begum. It is part of a 4-part series of roundtable discussions showcasing creative health leadership in the Midlands and beyond. To access other event recordings in the series, please visit the NCCH website at www.ncch.org.uk and view our blog pages. Now, without any further ado, let's introduce the panel.
Hi everybody, it's so lovely to see so many of you joining this afternoon on a really timely, important discussion. My name is Tamina Begum. I'm a South Asian woman with brown skin and brown eyes, and I'm wearing a green headscarf, and I have a grey background. So let's start. The transformational impact of arts on our health has been around for a millennia, and we know various studies and various research have been coming out in abundance. Notably, the World Health Organization has collated over 3,000 studies to now realise that arts is so beneficial for us all. It's significant in terms of the reduction of ill health and the promotion of good health and the promotion of management of diseases as well. So thinking and bearing all that in mind, inequality still exists. And my first question, I'm going to come to Mubashir and Helen. And thinking of the work that you do around public health, what are your thoughts on how healthcare quality and accessibility can be harnessed for all sections of society?
Do you want me to come in?
Yeah, that'd be great.
Okay, so hi everybody, I'm Helen Harrison. I'm Assistant Director of Public Health in Birmingham. I'm a white woman in her 40s. I've got blondie browny hair that's tied up in the moment. I'm wearing a black and floral blouse, and I've got a grey background. So I've been working in public health in Birmingham for about a year now. Birmingham's a super diverse city, so it's really important for us in our role in public health to really understand the impact on health and illness in order that we can diagnose and develop interventions to be able to support our population to thrive. So we know that there's huge inequalities in health outcomes that are experienced by people in our ethnically minoritized groups. There's a range of preventable and treatable conditions that are that are disproportionately impacting people within those groups. Things like mental health, infant mortality, asthma, heart disease, cancer. And we really saw this during COVID, how important it was that, and saw the impact that our services were having on people from different groups, and particularly those in our African and Caribbean communities. And the causes of this are really complex. So we call them the wider determinants of health. They're things like affected by things like income, education, housing, also really affected by racism and discrimination, both at individual and those structural levels, and by things like access to health information, access to health services, and people's own health-related behaviours. So it's been really important for us working in Birmingham to really understand how we can have an impact on that. And we have been starting to do that really through having a good look at the data. We're very intelligence-led in public health, but we also knew that it's not enough to club together all minoritized groups into one. So we've started to break that down into much more granular detail so that we can really understand the impact of health in our Somalian community, our Pakistani community, our Caribbean communities, etc. So we've been doing quite a lot of work to understand that. And now we're putting in place a lot of systemic action to be able to address the causes of some of those inequalities and to work closely with our communities. And the arts has been a very powerful way in enabling us to do that. So we've got a number of projects now where we're really starting to realise the power of the creative arts to be able to enable us to understand the different perspectives from our communities, hear their voices in their own way, creative ways, to be able to put some meat on that data so we can really understand how that we can take things forward in health. So I think there's probably some really good learning that we can share from the health perspective with the creative arts and how we're starting to address some of those inequities.
Brilliant. Is there, looking specifically at creative health, has Birmingham got their own strategy? I'm working with, other partners. How can, as an emerging field of creative health, really embed themselves into the healthcare systems, which is predominantly ethnic minority communities, probably come into the route of creative health through a health route rather than that route? How have them, or have you started thinking of that in a strategic way, whether that be long term or short term?
Yeah, so we're starting to look at it. So previously we would commission sort of smaller projects that had an art focus and a particular community. And yes, we're still doing that. They're almost our proof of concept so that we can start being able to say what the impact is of those programs. But we've also now developing a more strategic approach. So we're working very closely with our big arts institutions, and we've put in place roles within those arts institutions that sit across public health and the arts, so that we can learn together how we can maximise the arts in improving health outcomes, particularly around public health, but also how we can evaluate the impact of that. And a lot of that work is focused on our different communities, some of our more deprived communities, bringing arts back into those communities and making them more inclusive. And we're already starting to see some really good learning, shared learning across that. We had a really good partner meeting with them a couple of weeks ago where they were sharing how much they've learned and how that's changed their approaches to working with communities and working on sort of evaluating and monitoring impact. So we haven't got our strategy yet, but that's what we're working towards. And we are definitely having a more strategic approach to it and starting to build momentum around it in Birmingham.
Brilliant. You talked about the impact that you could already see on certain of them projects, and you're starting to collect that evaluation. Could you unpick a little bit of some of that learning that you might have seen already?
Some of the learning we've seen at the moment has been sort of around how our arts institutions are approaching their work with communities. So rather than putting out, they're going more into communities and going into the communities that are probably a bit more underserved by the arts organisations. So they're using this public health approaches of targeting, of understanding their different communities, and then also putting in place these evaluation templates. So before they would offer, they would have sort of educational programs offered, but wouldn't necessarily think about, well, what's the impact of that on mental well-being? And now they're starting to measure some of that as well, and they're becoming more engaged in thinking, okay, well, what are the impacts on their wider health outcomes? Because the more we can demonstrate it, the more we'll be able to apply for the funding to be able to say, by putting this in place in the arts, we can have these outcomes in our mental well-being of our populations.
Yeah, that's brilliant. Thank you, Helen. I'm going to move on because that actually comes in really nicely sort of to the sort of next segue and thinking about creative health. I'm going to come to you, Jamelia. You lead an amazing Black-led arts organisation, and I'm really interested in your opinion on how we formalise and label creative health or creative activities.
Yeah, hi everyone. My name's Jamelia. I'm the founder of Writers and Scribes. I am 36 years old. I am of Caribbean heritage. I have straight hair and I'm wearing an African print dress, and my background's kind of blurry, but mostly cream. Really excited to be here to be involved in this conversation. I think that having run Writers and Scribes for 10 years, that creative health is something that has been happening on the ground for a long time, that lots of communities have already been participating in what it means to do creative health, to have creativity that impacts people's well-being. And for me, I think what we need to have is more of a joint up discussion between both sectors to identify what we're talking about when we talk about this sector. And because we are in a new and exciting phase of it, to ensure that those conversations involve culturally diverse practitioners, service users, health workers, to make sure we're included in the conversation. I've been quite fortunate to have like very supportive councils that I've worked with, particularly Wandsworth, and sitting on the Creative Health Board. And we have done stuff in Wandsworth, like having a switch programme, which was around putting artists in residencies in Black barbershops in the borough, and particularly to reach Black men from a creative standpoint. I think that there are lots of grassroots organisations that may not know that what they're doing is considered creative health right now. And it would be fantastic to find a way to include them in the conversation and to the wider research and data collection that's happening right now.
Yeah, so the All Parliamentary Review sort of formalised what, there's so many different aspects of creative health, and we can't encompass everything in them reports, but do you think there's specific ones that could be highlighted for different communities and different cultural communities that could be brought to the forefront?
I think what we've found in our own practice, we've been working particularly with a lot of African Caribbean elders over the last few years, and their love for song, music, poetry, telling stories, acting out stories. They've got lots of stories to tell, and doing like inclusive theatre with them, dance for Somalian women. I think there's lots of different ways that communities are coming together, and I think that the more that we have these conversations, the more people will be aware of the different things that are happening as well. Obviously, we're also talking about structural and systemic racism that happens both in the arts industry and in healthcare. And so we're at an intersection of both of those things in this new space. And I think that's why it's important for us to identify and learn from what has happened, and while we're creating something new, to address those things as soon as possible.
Yeah. What do you think? What are your opinions on the barriers to minoritized communities sort of coming into the art sector? Would you say it's more the health? What are your opinions from your experience?
Definitely. I think from an arts space, a lot of the things overlap in terms of education, background, places that you live, what access you have to cultural activity, also the amount of value that is placed on access to culture if it's expensive and other things need to take priority. So I think there's a lot of people from Black and ethnic backgrounds who come to the arts later in their life, who switch careers, who access it when they have more money. And so like what we do is a lot of free development programs, entrance to getting those tools and being able to create space for people to equip themselves in the arts space. So I think there's definitely still barriers in the arts. It's very hard to sustain a living as a freelancer anyway, but that is multiplied when you're from an ethnic background. So I think there are lots of things to discuss in that.
Yeah, brilliant. Thank you, Jamelia. I'm going to dig a little bit deeper now, and I'm going to come to you, Tanisha, and I'd like to explore a little bit more in terms of inequality and sort of the structural layer of it. You're a lecturer in racism and health at King's, and I'm really interested in your thoughts on language and cultures that perpetuate inequality, and how that sort of feeds into the structural and systemic nature of inequality. And there's research and papers coming out around not only thinking of the macro elements of someone's individual health, but also the chrono elements of, whether that be intergenerational trauma or whether that be, from a country that has been colonized and things like that. So I'd just be really interested in your thoughts and opinions around that.
Yeah, thanks so much, Thamima. So hi, everyone. I'm Tanisha Spratt. I'm a senior lecturer in racism and health at King's College London. I am a mixed Black woman with big curly hair and glasses and a black t-shirt, and there are flowers just here in the background behind me. So yeah, thank you so much, Thamina, for that question, and thank you so much to you and Jane for inviting me to take part in this. I'm really excited to be here with everyone. So when it comes to the systemic, we have statistics that are very well known. So we know, for example, that in the UK, Black women are 4 to 5 times more likely to die during pregnancy and childbirth than white women. We know that people who are racialized as Asian in the UK are 2 times more likely to die during pregnancy and childbirth than white women. Black men are around 5 times more likely to be detained under the Mental Health Act than white men. These statistics go on and on and on. And one of the things that is really important to think about with this is how we kind of situate this within our political climate. So in the UK, we often, people like me that do this kind of work often face this broader culture of racism denial that makes it so that we start from a place where we have to explain and kind of prove that racism exists before we even get anywhere. So with these kind of statistics, I'm not sure how many of you would have read in 2021, the report came out that was headed by Tony Sewell that basically describes institutional racism and talked about how it seemingly doesn't exist and we should talk about class rather than race. So I think that it's really important when we have these discussions to kind of situate them within the context that we're working in when we're trying to promote change, and to focus on the kind of resistance that often comes when you're trying to implement any kind of change, whether that's in creative health or whether that's in addressing some of the barriers to care in the NHS, all of the kinds of things that we're doing to try and fight racism in health and in healthcare. And also when it comes to kind of language and when it comes to culture, I think another thing that's important to think about, and something that's particularly important for creative health, is this question that I'm really interested in, which is around kind of individual responsibility and what that means when it comes to health. So when you're talking about a systemic issue like racism, what does it mean to kind of individually manage your health, or feel like you have to individually manage your health in order to combat those systemic forces that are discriminating you day to day? What kind of effect does that kind of push towards resilience have on your health, and how can creative health kind of mitigate that? So one of the things I've been thinking about recently, I can talk about this all day, so stop me, I'm going over time. But one of the things I've been thinking a lot about in my work at the moment, whilst I'm writing a book about grief and who we grieve and why we grieve them and how racism shapes that, is the kind of counter to that, which is another area that I'm moving into, which is thinking about joy as a health promoting resource, and specifically thinking about Black joy and how that can improve health outcomes for Black Britons. And I've been reading a lot around this, and recently I came across this book by Christina Sharp called Ordinary Notes, and it's fantastic. Everyone should read it if you can. And in this book, she talks about how she's trying to describe beauty as method. So thinking about cultivating beauty through creative practices in a way that sustain Black health specifically in amidst this violence. So I actually have an image that I can show you. Hopefully you can see it on the camera. So here she shows a picture of a dress that her mother made for her, and she's put a lot of care into kind of stitching. I don't know if you can see here clearly with like tulips, and she's made it beautiful for her to kind of cultivate this beauty at home, and to make her feel precious in a world that doesn't see her that way. Sorry.
Yeah, absolutely. And I totally can relate to many of the aspects that you're talking about. As an art therapist, I've worked with many groups and individuals working through racial and intergenerational trauma, and using arts as a mechanism to sort of create that safety and that sense of belonging to a group, to evoke conversations and evoke sort of that awareness. And I remember a couple of years ago, I did a project around racial trauma called The Colour Palette. It's online and it explores racial trauma. And within that, 3 different generations of groups, many of them didn't even understand that that's what had happened to them. And it was that feeling of someone else said that, oh, I relate to that. And that's where I think creativity is so powerful, that you can discuss lots and lots of political, social, global issues in a really, really safe space. But thank you so much, Tanisha. I'm going to move on to the next question because I know we're on quite a tight deadline structure. So I want to open this question up to the whole panel, and I want us to think about sort of the elements of what we've talked about, but the redistribution of power and redistribution of knowledge power, because we've got people in this room that are from the UK, but also from around the world and from the global south as well. And the UK and the US are sort of leading in this field around arts and health and this creative health. And I want us to think about how do we redistribute the knowledge power, particularly in strategic spaces and large scale network events. How do we give creative health professionals, both in the UK, access to these shared spaces?
Can I come in?
Yeah, of course, Gavin.
Thank you. So I'm Mubashir Ejaz. I'm the Head of Health and Communities at the West Midlands Combined Authority. I'm a South Asian man in my 40s. I'm wearing a navy coat and a navy shirt, and my background is grey and orange. Hopefully I did that right. I'm also wearing glasses, if that helps. So just a little bit of background before I get into the question that's been posed. I think, just picking up on some of the points that Helen has said and Tanisha has said, the role, I suppose, for the combined authority in this space within West Midlands is to collate some of the information and actually spread the message across the region and across government as well in our connections through the mayor. And what I would say is absolutely spot on that we must recognize racism exists and call it out in the first instance. And one of our recent reports around the health of the region highlighted structural racism as a key driver of health inequalities in the region. And to be able to say that is critical. And then highlight how we can take action against reducing some of those inequalities. And that comes into taking actions through the wider determinants of health, as Helen has already mentioned. But in the combined authority, that has included looking at culture and health. And within that, we're looking at the creative arts, we're looking at heritage and how that can make a difference. Because when you look at it, it's easy to, it's not easy, there is a lot of evidence, as Tanisha has said, around the clinical outcomes and the health inequalities that exist within that space for racialized communities. But there's also a lot of evidence of the impact the creative arts can make in improving some of those outcomes that the decision makers within the NHS are interested in. Be that the cost to the country and the savings that can be made. The NHS cost savings from some analysis show with creative arts can be up to 168 million per year just for GPs. There's a lot of evidence that's out there, but what we don't focus quite a bit on is the access then within the creative health space for people, and the disparities that are showcased in the outcomes are seen within the people as well. Definitely deprived areas feel more of the pressure, but definitely within the minoritized communities, as Tanisha again mentioned, we see a huge difference where access is 78 to 81% by white or mixed ethnicity groups, whereas Black and Asian ethnicity is 61 to 63%. So what we need to do and what we're trying to do at a regional level is make some noise, collating the good work that's happening with Birmingham City Council and other local authorities within the WMCA region, and make this region be the lead in culture and health. And when there was a shortfall in the cultural budget from Birmingham City Council, we were able to extract money from government with £15 million to keep some of those programs going. And I think that's the role that we need to do. So when we talk about access, back to your question, Tamina, when we talk about giving access to people for these resources and the programs, I think that's where we need to work with government, the advocacy of these shouting loud about racism existing, the impact the creative arts can make, and the disparity in access that exists within that space itself that leads to then the outcomes disparity in clinical outcomes. So I think that's the role we can play, the role mayors can play, and the role us as practitioners in this space can play.
That's brilliant. I'm just going to touch on a point that Jamelia made. So Jamelia's organisation has been running for 10 years. How does someone like Jamelia and her organisation come into these strategic spaces, Mubashir?
So, I mean, I think it is about spreading the word and coming in and speaking at these venues to be able to make some noise about, because this is this is a space that we're just now getting into as a combined authority, because we work on a principle of adding value to what's happening at a local space. And so this is something where we feel that we can really add value, and now being able to talk about it and then sharing our kind of theory of change a little bit, and then engaging with the right organizations who are working in this space is the next step. But I think kind of spreading the word and awareness in these spaces is, I suppose, the kind of very preamble that needs to happen.
Yeah. Jamelia?
Yeah, I just wanted to add that often a lot of organizations like mine are small. We have like not a lot of people on the boards. There's not a lot of people who have time to come to these discussions because we're so busy firefighting and trying to sustain ourselves with funding, and there's so much work that we're doing on the ground that often what is missed is that we're just trying to survive, and so it's very hard to then find time to be part of the conversations we need to be in. And I think it's important for people to recognize that and also to figure out ways to invite. But another thing about accessibility is paying people to be part of a conversation so that they're not losing out by contributing to strategy and to plans for the future. So yeah, I feel privileged that I can be here today in this conversation because of a conversation that I had prior to this happening, right? But yeah, just to say that accessibility also leads to like how many of us are struggling to just make it through the year.
Yeah, thank you, Joy. Helen?
Thank you. Yeah, I just wanted to add on that point because I think this is something that we've been not struggling with, but trying different approaches to how we sort of engage with our hyperlocal communities and community organisations. And we've been learning and progressing our approach year on year. So we now have sort of a forum that we're setting up around communities, and within that we've commissioned community organisations to work with our very local communities to ascertain their own health priorities. We'll guide them and support them, but it's going to be very community led. And then they will be able to say, okay, this is what priority we want to focus on, and this is what help we need from you, from the wider system in order to do that, and we will support them through a collaborative approach. So we're very keen to be giving that power back into communities, and some of those spaces will involve the arts, no doubt, because we've done quite a lot of sort of smaller projects on the arts, and we're also working through our hyperlocal arts forums as well. And we've been giving impact grants via that route to enable them to work with local communities on specific arts and health projects, and giving them a framework to be able to demonstrate that impact so that we can start building the evidence base for creative health approaches.
Yeah, brilliant. Jamelia touched on funding, and this is my last question for the panelists. As a new and emerging field of creative health grows in awareness and momentum, what are the panelists' thoughts on supporting creative health practitioners into training and into funding, in particular thinking about inequality? So like Jamelia said, there's many people that are working freelance, very small organisations. There's the introduction of the creative health framework, but what are your thoughts on things around ethics of care for artists, particularly socially engaged artists, and that working in this field, but also now the emerging creative health practitioners, with many of the discussions that we've just talked about, whether it be systemic racism or inequality, many will be coming in with their own sort of lived experience and stuff. So how do they hold that space for themselves, but as well as the participants, as well as Jamelia said, often small organisations are on, they're just surviving, they're on this treadmill and not thriving. How do we think about all these things as we're sort of emerging. It's a really fantastic opportunity because we're just at the start. So what are the panelists' thoughts on that? Does anyone know? Oh, have I thrown you?
I mean, I don't think there's, and apologies, I'll go first with respect to my panelists, but I'm not claiming to know the right answer here. What I'm saying is I think there's many avenues that can be exploited. But one such that comes to my mind is very recently we had some funds that were put out to communities for the Inclusive Communities grants on the back of the Commonwealth Games. And we specified access to community groups, small, large, to look into improving mental well-being, looking at improving physical activity, as well as taking cultural approaches to improving health. And while those type of opportunities are few and far between, I think there are a lot more opportunities in the mental well-being space, which I think can be exploited, for lack of a better word, for work that needs to be done within the creative arts industry. And that's mainly because a lot of the evidence that exists about the improvement in health from culture and arts lies within the mental well-being space. So I think to be able to make that connection and use some of the evidence that's already out there to make the case for organizations like ICBs who might have some funding in this space, or to local authorities, and even to larger philanthropic organizations, is to be able to make that case through the mental well-being angle and actually bring in the knowledge about how well creative arts can help improve outcomes in that space.
Yeah, thank you, Mubashir. Yeah, Jamelia?
I think it's also important for a network to be created that allows people to have access to information and training and understanding of how they can feed their work into this space. I think because it's new, not everybody knows about it, not everybody is aware. And I definitely think that there are loads of volunteer-led community practices and activities that happen that are just running on passion and goodwill, that if they had the knowledge and if they were trained and if they were informed, that they would be able to do much more and have greater reach. And so, yeah, I definitely think there's room for more input into how the word is spread to the people that definitely don't know enough about it yet.
Thank you. Yeah. Helen?
Would also say it's worth contacting your local public health teams because they often provide a lot of free training out to communities. So providing things like mental health first aid, suicide awareness training. In Birmingham, we also hold a series of webinars and lunch and learn sessions that are open up to our community members on a range of different topics. So I think there is a lot of free training out there. It's just how we make sure we get it to you and you become aware of what's available.
Yeah, absolutely. Yeah, it sounds like there's a lot more joint up thinking because of the new field that it is across arts and across health. It's just that joined up thinking and knowing about the networks and knowing about what's going on. Tanisha, did you want to come in and have any thoughts on that question?
Yeah, I mean, my kind of understanding of this is a little bit limited, certainly more so than the other panelists. As an academic, when you were talking, I mean, I was thinking it would be so great to be able to partner with practitioners, with creative health practitioners in the kind of work that we do. And it's something that I myself and a lot of academics that I know are always really, really excited about when it happens. So it's a way of kind of providing that institutional support to practitioners and kind of lending a hand or collaborating or doing both.
Yeah. I think you're spot on, and I'm really lucky to be part of a research team with the UKRI, and I know Sarah's here from CAST, and with Sheffield Hallam University, and they're doing a lot where they're using the community assets in the community to drive and have embedded researchers and have creative health associates embedded in the community. So I think that's happening, and that's if that's the redistribution of that nationally and internationally, I think that's a really good pilot to sort of learn and get that data from. But I know we are running behind, Jane, so I'm going to hand back to you because we're going to have our breakout rooms, aren't we, Jane?
Thank you so much for that. That was really great. I'm going to quickly share for everyone what the questions are for our breakouts. So we have 2 prompts that we want you to talk about. Feel free to contribute as much or as little as you feel comfortable. So the first one is, in your own opinion, what are the key ways that we could mitigate inequality in creative health? And then secondly, who do you think are the key people or organisations who can contribute to the levelling up of underrepresented practitioners, researchers and strategists? And how? How would you like people or organisations like NCCH to be supporting this cause?
Okay, I think we're going to get going because we've just got just over 20 minutes and I really want to hear some of the reflections and feedback from them breakout rooms. So I'm gonna come to Alice maybe, and maybe hear back from some of the reflections in your group, and if you want to bring in any of the participants to illuminate any of the points that were raised, that'd be great as well.
Thanks. Yes, we had lots of discussion about the importance of bringing people together and learning from the communities. I think Charlie was talking about the fact that there's so much going on that, as I think you said earlier, that isn't seen as creative health, but we need to learn from those communities, and maybe just the context of actually highlighting the fact that it is creative health needs to happen. And there was also the point that it depends who the gatekeepers are for some of this work. So social prescribers who might not have a sense of the fact that there would be interest in creative health groups with particular communities. So it might be their racism or their lack of understanding that it stops things happening. So then we need education around that and training and kind of challenge, I think, as well.
Yeah.
So those were some of the points from the first conversation. Yeah. And then with the second one, it was about who do we look to support those networks, and it was definitely the idea of the ICBs and local government, the VCS sector, and the trusts themselves, that there is a beginning to be a bit more understanding about the importance of this work. So
yeah. Brilliant. Is there anyone from your group that wants to
does anyone want to add anything? No?
Yeah, that's okay. That's absolutely fine. Can I come to you, Jamelia? What kind of things were discussed in your group?
Yeah, we had a really rich conversation about some of the strategies that have been put in place to help make sure there's more diverse communities, on making decisions around funding, on recruitment boards. We also talked a lot about what is the governance, who's in the room, some experiences of being in conferences where the Black people that were there were actually part of either the patients or the entertainment, but not really as part of the expertise. We talked also just about what it would mean to have a network. I was talking about writers and scribes, and the fact that we, with you, Femina, are hoping to create like a network of creative health organisations that are culturally diverse, and to enable us to have more of a say and an influence in what is happening. We also talked about what is even the benefit of these organisations joining the movement if what they see is lack of representation, and also that it takes a lot of emotional labour to be in spaces where you already feel different. And so the need for things to change before the offer would even be necessarily accepted by the ones that we want to include. So yeah, we talked a lot about that. I don't know if anybody from the group wants to add anything to my review.
Does anybody from Jamilia's group want to add anything? There were some really, really interesting points about the networks and, you know, who has them spaces and who doesn't. And I come from a background of voluntary sector as well, and often funders, particularly when they're looking to give funds for a specific topic, whether it be marginalised communities or whether looking at something, they will go to the sort of biggest led Black organisations and not look for the smaller ones. So it actually is on the flip side where, you know, they're almost gatekeepers to their own community. So I think there's a lot more work and a lot more understanding that needs to happen around that as well. So yeah, Jane, should we come to you next? Did you lead on a group?
Are you talking Jane Hearst or Jane Howard?
Jane Hearst. Jane Howard. That, yeah.
Jane Howard. We have this confusion all the time. Great, thanks. Thanks very much. Yeah. So we had a sort of research heavy group, I would say, which was interesting. So we were thinking the conversation was very much about research and about who is or isn't involved in research, and we came up. There was quite a lot of discussion about funding, not really recognising the additional costs of engaging people who may be from groups that are otherwise not heard. So costs of things like translation costs, which it becomes difficult to put into applications for research funding. Your funding might not, you know, be judged. It might be judged as too expensive, but actually, without that, you are excluding a whole load of people from being involved in research. And also alongside that element of the actual research, there was also the work involved in pre-grant applications. So when you really want to engage with communities to help to co-design the research, and no one's funding that, and therefore again that excludes people who then aren't engaged in even, you know, identifying what the research topics might be and how those things might be approached. So yeah, quite a bit about that, and we talked a lot of that about the sort of structural racism and the racism in organisations that is unrecognised, but actually is there, that inhibits those things from happening. In terms of who do we influence, you know, we struggled a little bit with that. It was like, well, it feels to be like very senior level. Is it government? Is it you know, is it UKRI? Is it the research councils? And it felt to be all of those things. And I would say that the researcher, you know, the researchers sort of they don't feel they have a particular voice in that. Which was interesting in itself. So yeah, how maybe that is around other bodies, maybe bodies like NCCH and others really starting to raise these issues at a high level. Yeah. So if anyone else from the groups there, we had a couple of people who were in very noisy airports or other situations, so they might not be able to comment, but yeah.
Yeah. I just wanted to touch on, you talked, Jane, about some of the indirect stuff around the racism. Could you elaborate on that? Because this is the space to be opening up them discussions, I think.
So I think it was around exactly that. It was around that idea that if right at the outset there's no recognition of the need to, for example, account for the costs of translators, then you're immediately excluding a whole load of people for whose first language isn't English, and it might not be that if research is not even about that. It might not, you know, so when you've got research that's maybe focused on looking at experiences of different groups, maybe, you know, there's more recognition of the need for that. But if you're looking at research on, you know, a particular health issue, for example, that can affect people from, you know, across a range of sort of ethnicities, and there needs to be recognition that, you know, if you're wanting to get people whose first language isn't English in that room, you know, you will need to provide those things, and yet that's not even thought about. So it was a sort of ignorance around that, really.
Yeah.
And I think we also had a great example actually from Victoria, who has now gone, I see, but who spoke about a book she's reading called Unheard, The Practice of Silencing. And it's about the HIV and AIDS epidemic in the early 80s, and talking about how grassroots organisations were enabled to become, very activist and facilitate change, but that those conversations were still dominated by white middle-class men, and there were other groups that were not heard in that. So although it was good that they were able to facilitate that change, it was still a limited voices that were heard.
Yeah, and spot on, Jane. And I think it's really amazing that we've got this emerging field of creative health, but we know the dominant sort of discourse, the dominant voices that are leading it at a strategic level. So hence the reason I'm really, really pleased that Jane and the panelists have come on board with the conversation like this, because like Jamila said, there's lots and lots of volunteer-led grassroots organisations, and they're doing the work, but it's just not formalised in that way or articulated in that way. And I was just going to pick up on a point around the funding as well. So like whether it be translators or whether we're thinking about them small voluntary organisations, and you're thinking of funding applications when English isn't your first language and there's a certain mechanism or certain flow of grant writing and bids, then how are you ever going to sort of level up that hierarchy?
Absolutely.
As well. So that's the kind of things that I was thinking of as well, sort of thing. But thank you, Jane, that's brilliant. Did we have another group, Jane? Tanisha?
Yes, we had a group that had lots of different discussions about lots of different things. So with the first question, Lisa, actually, I don't know if Lisa's still on the call and I don't want to put her on the spot, but we were talking about age and thinking about creative health. So thinking about how we can get younger people more engaged in creative health. And Lisa's had some really great ideas about interventions at school level. So we were talking about that for a while. And then with the second question, I don't know if Reese is on the call, actually. Reese would be much better placed to kind of recount what we were saying. Again, don't want to put him on the spot.
You there? No, maybe not then, Tanisha. Maybe you could recap.
Maybe not. Okay. Yeah. Okay. So Reese had some really great points about some of the things that Birmingham City Council are doing and some of the partnerships that are happening at that level. But again, my internet's been really terrible today, so it's been cutting in and out. And so Reese would be much better placed to kind of reflect on that. Maybe they can put something in the chat. But yeah, we were talking at a strategic level about different partnerships and ways that we can kind of engage with each other, and thinking about community-led interventions and how to get people more involved at a community level in a way that's kind of collaborative and not I always think as an academic, I'm always wary of being extractive. That's a conversation that we always have about what it means to kind of work with partners and how we need to not kind of come in as the people who want something and take something. We need to kind of co-create. And then we cut out.
Yeah, and I think creative methodologies and creative methods, which all ties in with the creative health, are really good ways of eliminating that hierarchy. So groups, particularly vulnerable groups, have got that autonomy and agency to give what they want in their own terms as well. But that's great. Thank you so much, Tanisha. Mubashir, are you okay to share?
Yeah, absolutely. I was about to type it all in because I need to go in like a minute. But you know what? Actually, it might be much better to just say it. So we had a really good discussion actually around the ways that we can mitigate inequalities within creative health, and one of the things that's already been highlighted, which is working with partners that are embedded within communities. And actually specifically those that have lived experience of facing inequalities. So making sure that they're involved in any kind of initiative is key. Helen was talking about the public health approach that they've taken within the Birmingham City Council, which has been about building trust with communities through some of those approaches. It's also a little bit about looking into your own organization, and they've gone through kind of doing a cultural competence training within their own organization, which is brilliant. There was a question about okay, well, how do we get some of these communities which are facing inequality to understand what creative health can do for them? And the point was made that maybe letting them define themselves what creative health is for them. So some communities maybe not necessarily use the same language around creative health, but they will define how poetry has potentially helped them come through challenges faced in terms of health outcomes. And so I think that was a really interesting kind of point for the creative sector to actually understand, let communities define themselves what the arts can mean to them and their health. There was a conversation about, how do we overcome the barriers with access to, in terms of access, language, and transport, and what role GPs in particular can play in that space. And there was a little bit of a tension, because I think I came back with saying that GPs are already pretty overworked, but rightfully, I'm not going to mispronounce her name, but one of the members in the group said that they had already been working with some GP surgeons in this space, where they were able to get that GP surgery to get involved with the creative arts sector and to be able to help communities. But the other access that we could have is obviously through social prescribers, through link workers, to reach into the communities in the creative arts sector. In terms of the wraparound care. The other bit, the last bit I'll say is some of the organizations that we can work through. Obviously, integrated care boards are great, but for the communities, I think access through the integrated care partnerships is key to be able to gain access to decision making at a regional level within the health sector. So I'll stop there, and I'm going to head out. Apologies. Thank you so much for having me. And
thank you so much for joining.
Look forward to the work. Thank you.
Take care. Did we have any other groups? I don't want to miss anybody. Yeah.
Just your group left?
So just my group, and my group had very much the sort of similar themes to everybody else's group, and we had lots of discussion around who gets to decide what. So who gets to decide the research outputs, who gets to decide the funding, and we had discussions around targeted interventions. We talked about collective targeted, because at the end of the day, it's the ground staff and the ground grassroots workers that are delivering the work. So how do we sort of link everything together and make it much smoother, so everybody's views and perspectives are on the table. But yeah, I'm just aware we've got less than 5 minutes for a Q&A. I was just wondering, Jane, has there been any questions in the Q&A chat box?
I don't think I've come across any, but I might have missed some, so I will double check. If anyone wants to say another question out loud, please raise your hand using the Teams thing and I'll spotlight you.
Cool. Have we got any questions from our audience for either myself, Jane, or any of our panelists here today? We've just got under 5 minutes. Oh, I think we've stunned everybody to silence. I mean, we've answered all the questions. oh, we've got Helen here. Yeah.
Oh, hi. It's not really a question. I've been listening. I feel like I haven't heard enough about, although it was touched on, but enough about people defining for themselves what creativity is and was in their lives, and what the meaning of it also is. And also, there's just a whole load of stuff about interpretation, and what I'm not really hearing in the conversation is enough about social justice.
Yeah.
Like, if we're talking about mental ill health, the role of social injustice in mental ill health is not rocket science. And like, right, okay, we do all these interventions, and then we do all, what are we going to do about social justice, which we know is the primary cause? So sorry, that was a little bit more of a comment and a rant than a question.
No, and absolutely, I agree with you. A lot of the things that tie in systemically and structurally are them things that are counteracting with the social justice. So I think you're spot on, Helen. Did we have another question? Was it Layla? I think I had a question.
Yeah, and then I chickened out.
Oh. I saw you.
It was more. I chickened out because it's a very blunt question.
That's okay.
As a Caucasian person, I feel very passionately about addressing inequalities and structural racism, inequalities in outcomes, in health outcomes, and in diversifying the creative health, or even just the creative workforce. If you could tell me, I mean, can you give me tips as people from the global majority of things that are kind of your peeve annoyances, or things that how I can get it right and make sure that I give a voice and I make space for the change to happen, because I feel I have a responsibility, but I also fear sometimes to kind of commit some of that benevolent racism, I think it's called. Do you know what I mean? And it's kind of,
yeah.
I don't want to be patronizing.
Yeah.
Are there any pet hates that any of you have that you wish people like me would stop doing, or anything that you wish we started doing?
Yeah. I'll come to my panelists and then maybe I'll give my opinion at the end. Jamelia and Tanisha, have you got opinions on Layla's question, which I think is a really...
I'm sorry if it's super blunt.
No, I think this is a space to have them open and honest questions, and hopefully you've done it in a really you've done it in a really articulate way. So we're going to hold this space in a real space of care, so we understand it's come from a place of care. So
and I know it's not your role to educate me. I know that.
Yeah.
I just yeah. If like there's anything that you want to get off your heart, off your chest, please please go for it.
Jamelia and Tanisha, if you're happy to answer that question or give any thoughts on that question.
Yeah, I'm happy to
I can have a go. Oh, sorry, a bit of delay. Jamelia, very happy for you to go first.
No, it's fine. Go ahead.
Oh, I think Tanisha's frozen. Jamelia, do you want to go or?
Sure. Well, all I was going to say, I think for me is just tokenistic, like space where it's like you're invited to something and expected to speak on behalf of all Black people ever, but it's also just a tick box exercise that doesn't lead to any actual change, because it's just a waste of time. So I think that's like just one of my pet hates, is doing things to make it seem like we're being included, but actually it's just to spotlight it so I could be in a picture or something.
Yeah, I'd agree with Jamelia as well, but just to add on to that, in terms of what could be done, is I think just redistributing that knowledge power. So whilst there's things that are tangible and there's things that are intangible, and it's just about including and making sure that that voice is heard, but done in a really authentic way, but also the knowledge that you have. Whether we just talked about that funding rate, supporting in little ways, but also the larger ways, such as spaces like this as well. Tanisha, we've got you back again. Is there a really quick point, because we're just about to finish? Do you want to?
I'm so sorry, everyone, for my internet. No, I mean, I was going to make a point that's really similar to what I think Jamelia said about kind of tokenism, and just making sure that contributions are invited but properly integrated, and not meant as like a badge of honor for whatever organization is kind of promoting inclusivity and diversity, but maybe not implementing it very well. Yeah.
I think that's a really good place to stop. So I'm going to hand back to Jane just to say any final words, and yeah, I'll hand back to Jane.
Thank you so much for everyone for joining us today. And if you would like to discuss further any kind of ideas, then this is my email on the screen, jane@ncch.org.uk. Really appreciate you coming, and I hope that we can make some great movement as a consequence of this event. Thank you.